Hi, welcome back to DocTalk, sponsored by Anima Mundi PLLC. I'm Dr. A.
And I'm Dr. Regina Vanburg.
Thanks for joining us today. So today we're going to talk about the alphabet soup of mental health and what this means and demystifying all of these letters and acronyms and things that you're looking for when you're looking for a mental health provider. What's the difference? What should I know? Don't they all just do the same thing?
Right.
No, they don't. They don't, right?
They don't.
So yes.
So let's begin with level of education maybe behind what some of these titles mean. So let's start with folks that would fall into a master's category. So people who are providing therapeutic services with a master's degree that is supporting that licensure. So who would fall into this basket?
So we've got our licensed clinical social workers. That would be master's level.
Right.
We have our licensed professional counselors. That, also known as your LPC.
LPCs,
right? We've got our licensed marriage and family therapists, right? LMFTs. And these acronyms even change a bit depending on what state you're in. So in Texas, we've got LPC. In Massachusetts, they've got LMHC, right? Licensed mental health clinician, right? So it changes, right? Depending on where you're located. All master's level.
All master's level. And even though all of these individuals can provide therapy in some form or fashion, they do tend to have different emphasis points. So a social worker may be much more focused on kind of socioeconomic things, kind of your life as a whole, not just the therapy piece.
Case management,
that kind of thing.
Emotional support, right?
But it isn't always the main thrust of what their training or what their practice is.
So LPC is going to be somebody who is trained to do therapy, right, at a master's level. That is what they do. It's probably a broader emphasis, more kind of general mental health style. So you might come into them for depression, anxiety, stress, but it's usually going to be for psychotherapy, right? So you're coming in to see them for therapy.
Right. And then finally, we have licensed marriage and family therapists, LMFTs, and their main emphasis is usually couples and family.
Absolutely. And so this is going to be your go-to, and I always tell people this. If you're coming in to see somebody for couples therapy, it doesn't mean your LPC can't do it. They absolutely can, right? It falls under their licensure. But if you want somebody that specializes in this, they got the extra training, this is what they know how to do, you want the LMFT, right? So it's like the difference between maybe going to somebody for specific coaching that has that background in it versus somebody who's just kind of a general coach, right? Like going to somebody that is maybe a high school coach versus somebody that just coaches like soccer, right? If I want to be the best that I can be at soccer, I want to go to the coach that knows how to, teach me in that area.
Absolutely.
So things to consider when we're thinking about who to visit, who do I want to be looking out for, who does my insurance cover, or who's available in my area.
Absolutely. And I think one thing I might add here is, in this category, master's level providers, please do correct me if I'm wrong, assessment does not fall into this domain. So if that's something that you're looking for, that's probably not going to be someone that's on this master's level. It's going to be someone who's in more doctoral level, and that's what we're going to talk about next.
Yeah. So what's the difference, right? So master's level providers probably go to school for their, 4-year degree. They get their undergraduate degree. They go into a graduate program, a master's level program, 2 to 3 years at most. They take their licensure. Boom, they're ready to rock and roll. Right?
That's it.
When we think about people that are at a doctoral level, these are going to be your psychologists. This is different. This is a doctor, right? So this is somebody that has either gotten their PhD, right? Or somebody that has gotten their PsyD, which is going to be their doctorates of psychology.
Right.
So these people have likely gone to a master's level program already and then moved into a doctoral program, or they've done a program that combines them both, where they get kind of that master's level training and then they kind of stack on the additional doctoral level training. So this can be anywhere from, 7 years maybe if you add them both separately, or if you're lucky enough to go to a program that'll give you both 5 years, right? In addition to their undergraduate degree, right? So really a big difference in training.
Yes. And I think we can even parcel that a little bit further for you between a PhD and a PsyD. So a PhD means Doctor of Philosophy, and often there will be a very strong research component there,
Mm-hmm.
whereas a doctorate of psychology is it's a clinical degree, meaning there's research, but it isn't the main thrust. Really what we do day in, day out is we practice, learn, and refine these clinical skills. And both of these can make you a psychologist. So if you see these two acronyms, PhD or PsyD, I almost didn't know what I had for a second. They mean the same thing.
Absolutely. So now, taking it a step further, what is the difference between a psychologist and a psychiatrist, right?
Mm-hmm.
There's a big difference, right?
Great.
So our psychiatrists are those that have gone to medical school and then done their specialty in psychiatry, right? So these are your prescribers for the most part. This is the person you go to that is specialized to prescribe mental health related medications. So mood stabilizers, your anxiety medications. Could your local, PCP do this, your primary care physician? Sure. But oftentimes once you've reached maybe a certain level, they will send you over to a psychiatrist. It just depends on the severity of the issues that you're encountering, right? Either way, both medical providers, right? Mm-hmm. They prescribe the medication, whereas somebody with a PsyD likely isn't going to be doing that or shouldn't be doing that unless they have gotten the additional certifications required that are allowed in some states, right? Yeah. Louisiana allows it. There are different states where you can be a psychologist, go to school for that additional 2 or 3 years, I believe, and then you can prescribe as well.
Right. And
Texas is not one of these.
It is not one of these. But I think, Dr. A, you were mentioning that there's maybe 13 states that allow this, so it's actually relatively rare for a psychologist to be able to legally prescribe medications.
Yeah. So, things to keep in mind, right? So when you go into your psychiatrist, this is probably why you don't get 45 minutes to an hour with them. It's quick. 10, 15 minutes, check in to see how, medication's working, boom, you're out of there. Right? And this can also leave people feeling some kind of way because they think, I'm supposed to come in, right? I'm supposed to sit down and talk about what's going on with me. Right. And that's a different provider, right? So your person that you're coming in to see for 30 minutes, 45 minutes, or an hour is going to be your psychologist. That is the person that you're doing your psychotherapy with, that you're doing evidence-based protocols with. This is who you see to kind of work through that, to learn those skills and to develop that. Not that that can't be done with one of the master's level clinicians that we talked about, but like we said, the training is very different and so is the specialty, right?
Absolutely.
So knowing what you're getting when you're going into this, right?
Yeah, and having those expectations kind of match. I think how easy is it to think that you're going to go in and have a conversation, about change, about, to engage in psychotherapy and that not happen, be like, oh, this doesn't really work.
Absolutely.
I don't really like this.
Mm-hmm.
And, I think maybe this is a good time to bring in the research here too. What we have found across the board is that change happens more quickly and is sustained for longer periods of time when these two methods are used in tandem. So if you are using some kind of pharmaceutical, some kind of medication from your psychiatrist, it is still really helpful to be engaging with someone who's providing some kind of psychotherapy. Absolutely. These two things together, this is the golden ticket.
That's the key, gold standard, right? Because we take away the medication or the medication stops working or we have to up the dosage, but the problem's still there.
Right. There was no skill learned, to kind of help proceed from that point on. Now, this is not to say, I want to be really clear, that if you're in psychotherapy, that doesn't mean that you have to have a prescriber. You don't have to take medication. If and when that is appropriate for you, we recommend both of these things together, but feel free to seek psychotherapy services without
any type of medication. Absolutely. And so when might they seek medication?
Great question.
That's a good question, right? So when we're thinking about this and I'm working with people, I often tell them, if the symptoms are making it so that you can't engage in psychotherapy, that is a really good indicator, right? So if you are so anxious that you cannot work, you can't leave the house, you can't function, then it's probably a good idea to utilize the medication in combination with psychotherapy so that you're able to get this under control. And what that means is that it doesn't mean you're going to be on it long term.
Right.
You would work with your prescribing provider to go ahead and get on that. And then as you learn the skills and kind of things balance out, probably go ahead and just decrease that with and under the supervision of your medical provider.
Always.
We don't ever recommend just stopping things cold turkey because remember, when you're taking medication, this is going to be impacting and affecting the chemicals in your brain, right? So it's never a good idea to just cut it out cold turkey. It should really be with your prescriber.
Absolutely. We hope that provides some clarity. Here at Amundi, we are both PsyDs. We are doctoral level providers of psychotherapy.
So thanks for joining us today as we talked about alphabet soup and mental health. Remember to like, comment, and subscribe.
And if you're interested in seeking us for therapy or you just want to learn more about Amundi, please do check out the link in the box below.